On your Health Watch this morning, as spring break travel approaches, health officials nationwide have issued warnings about the spread of measles. There are now more than 321 cases confirmed in just Texas, Oklahoma, and New Mexico. Most of those infected were either unvaccinated or had unknown vaccination status. So joining me now is Dr. Mark Dworkin, a professor and associate director of epidemiology at UIC. Thank you so much for joining me this morning, doctor, to talk about this.
Thank you and good morning.
All right. You know, there's so much anti-vax talk going on right now. We could go on and on about why that is. We all know, most of us do. But why do we need to be concerned about these measles outbreaks, especially during spring break this year, despite the fact that our current Health and Human Services Secretary, Robert F. Kennedy Jr., said, weeks ago, oh, these outbreaks happen every year?
Yeah, we need to be concerned about measles outbreaks because we're not supposed to have measles outbreaks. Basically, measles has an effective vaccine, and millions of people have received it. And it has driven the number of measles cases down. It's that effective. So when we hear about vaccine hesitancy, it's not a surprise, given how uncommon measles has become, that a lot of people don't understand what measles used to do. Measles, before we had a vaccine, killed hundreds of children every year, and it hospitalized around 48,000 children every year in the United States. So it's important that when we have outbreaks of measles, we take it very seriously.
What precautions do you recommend for those who plan to travel, especially to Texas, New Mexico, Oklahoma? And how soon before traveling should someone get their vaccines if they are not up to date?
Well, whether or not somebody is traveling, everybody should be up to date on their measles vaccine. That is, they should have received at least one dose if they're not over a certain age. In other words, people who are in their late 60s, 70s, and older, those people probably had measles when they were children, and they get to keep that immunity. That is, they're not going to get sick from measles if they're exposed for the rest of their lives. But we really hope that everyone will have at least had one immunization and that they get their kids vaccinated too. As far as how long before travel one would want to immunize, as long as possible before travel, but basically, even within a few days of getting the measles vaccine, antibodies are starting to show up in the blood, and within 2 to 3 weeks, they say you've got protection.
And for those who might be listening to this and still think, well, you know what? Vaccines, I'm not so sure they're safe. What would you say to them?
Well, what do they mean by safe? You know what I'm saying? It's like this vaccine's been administered to millions and millions and millions of people, including millions of children around the world. And it's done a fantastic job. And the side effects are uncommon. They're rare. Serious side effects are very rare. Whereas if you get measles, if you get infected with measles, 1 in 20 will get pneumonia. I'm talking about 1 in 20 children will get pneumonia, and pneumonia is the main cause of death among children. So if you're weighing things out, it's better to run away from measles and run to the measles vaccine.
And in the case of an outbreak, right, it sometimes takes a couple weeks for these cases to start popping up, and thereby they can continue, this outbreak can continue for weeks and weeks if people who haven't been vaccinated are exposed. Is that right?
Yeah, basically, if somebody is exposed to a person with measles and they're susceptible, they can get it, then it could be a week, 2 weeks, even 3 weeks sometimes before they even begin to get sick. And so this spreading out between cases can cause these outbreaks to go on for quite a long time.
Okay. All right. This is really helpful information. Dr. Mark Dworkin, Professor and Associate Director of Epidemiology at UIC, thanks so much again for joining me this morning. We appreciate your time.